Welcome to this brief episode of Things You Don't Know. We're doing this because it's a follow-up to the episode we did on the bacterial outbreak that has been plaguing the United States. Since our recent episode about that contaminated produce, the situation has changed dramatically. This is no longer a limited warning involving a few isolated cases. Thousands of illnesses are now being investigated, and health officials have identified a major lead involving iceberg lettuce.
The illness is cyclosporiasis. It is caused by a microscopic parasite, not a bacterium. Since May 1st, the CDC has received reports of 1,645 laboratory confirmed cases acquired inside the United States, and more than 5,100 additional cases still require analysis. 34 states have reported confirmed cases. 141 patients have been hospitalized, and no deaths have yet been reported. Those numbers need explanation. The 1,645 cases meet the CDC's strict definition for confirmed domestically acquired illness. State health departments are also counting probable, suspected, and recently reported cases that have not completed the federal review process. Those categories overlap, so the numbers should not simply be added together.
Michigan is the clearest example of how quickly this outbreak has grown. Earlier reports listed approximately 3,000 cases. By July 16th, Michigan was reporting 5,002 cases, 5,000, including confirmed and other cases being investigated. At least 102 Michigan patients have been hospitalized. This is kind of an extraordinary increase. I cannot emphasize that enough. Michigan normally sees only a small number of cyclosporin cases in an entire year. The state's numbers also demonstrate why federal and state totals may appear inconsistent. Investigators are working with different reporting dates and different levels of confirmation.
But the basic warning is not confusing. A large number of people have become sick. Many cases are still being evaluated, and the investigation is continuing.
And Chandler, you know someone who's been hospitalized in Virginia about this, right?
Yes, I do. Someone who lives in Abingdon, and they describe it as not a very pleasant experience, I must say, Dr. Weaver.
I think you're understating it, because when you were telling me, you were saying the person was experiencing projectile vomiting, explosive diarrhea, and intensive gastrointestinal pain and problems, correct?
Very correct. Quite correct, Dr. Weaver.
Okay, so what have investigators found so far?
Federal investigators have linked the major five-state portion of the outbreak to shredded iceberg lettuce served at Taco Bell locations in Indiana, Kentucky, Michigan, Ohio, and West Virginia. Among interviewed patients who reported eating there, 90% said they had eaten iceberg lettuce.
The FDA traced the lettuce to Taylor Farms de Mexico. A sample of shredded iceberg lettuce from that supplier tested positives of cyclosporin. The Taylor Farms removed iceberg lettuce sourced from central Mexico from the United States market, and affected products were recalled. However, investigators have cautioned that the five-state restaurant cluster is only part of the larger national situation. Other sources or distribution channels could still be identified, and I think they will.
I do too, Dr. Weaver, and that distinction matters here. Investigators have found an important source, but they have not shown that every reported illness nationwide came from the same lettuce, restaurant, farm, or the same distributor.
Okay, what is important here? Consumers should check refrigerators for recalled iceberg salad or shredded lettuce. The recall includes certain market side products sold at Walmart with best if used by dates from July 18 through August 3, along with a larger list of food service products.
I cannot emphasize this enough, ladies and gentlemen. Do not eat recalled lettuce. Discard it or return it to the store. Clean and sanitize all containers, refrigerator shelves, countertops, and utensils that may have touched it. At restaurants, consumers can ask where the iceberg lettuce came from. People should also watch for symptoms. The most common sign is frequent watery diarrhea. Other symptoms can include stomach cramps, bloating, nausea, fatigue, loss of appetite, and weight loss. Symptoms usually begin about a week after exposure but can appear anywhere from 2 days to 2 weeks later.
And this illness can appear to improve and then return. Anyone experiencing continuing or recurring diarrhea, especially after eating shredded iceberg lettuce, should contact their healthcare provider immediately.
Tell the provider that the cyclospora exposure is possible. Detecting this parasite may require a specific stool test that is not always included in routine laboratory testing. More than one sample may sometimes be needed. Patients should also provide useful details when symptoms began, what produce they ate, where they purchased it, and which restaurants they visited. Saving receipts, packaging, photographs, or loyalty app purchase records could help investigators reconstruct the supply chain.
That's right, Dr. Weaver. And report suspected illness to the local health department. Individual reports can reveal connections that are invisible when each case is viewed separately.
This outbreak demands more than a recall. Investigators must determine exactly where the contamination entered the system during growing, irrigation, harvesting, processing, transportation, or food preparation.
Our earlier episode raised questions about water quality, agricultural practices, and industrial contamination. These remain questions, not established conclusions. Nothing in the current findings prove that fracking or any other specific industrial activity caused this outbreak. It may have contributed, though.
Yes, sir. Discovery requires evidence. It also requires transparent supply records, fast laboratory reporting, cooperation from restaurants and distributors, and enough public health personnel to interview patients before memories, receipts, and food packaging disappear.
Officials should disclose what they know, what they suspect, and what remains unproven. Companies should respond quickly rather than waiting until every legal question is settled. And public health agencies, I can't emphasize this enough, need the authority and resources to trace contaminated food before thousands more people become ill.
This update is a warning, but it's also a call to action.
Check recalled products, report persistent symptoms, preserve information that could help investigators, demand accurate answers about where the contamination began and how it traveled so widely.
And thankfully, no deaths have been reported, but thousands of illnesses and more than 100 hospitalizations are not a minor event. The source must be traced, the failures must be identified, and the next outbreak must be stopped earlier.
Yeah, this investigation is still developing. We will continue following the evidence, and we will return with another update when the facts change. Thanks for tuning in. Hey, look, stay smart, check things out, report it when you need to. Thanks for listening. Come back soon. Bye for now.